Hey guys, I'm going to talk about neurological emergencies, and I understand that some of the crispness in the video on your screen here is not ideal. So feel free in Schoology to follow along with the PowerPoint. You have the exact same thing here that I have, so you can kind of follow along with what is up on the screen if you can't see it that well. So what we're going to talk about is neurology. So the brain, anatomy, the presentations and management of patients with decreased levels of responsiveness, seizures, as well as stroke. Anatomy, physiology, pathophysiology, assessment and management of strokes, transient ischemic attacks, also known as TIA, and seizure. Status epilepticus, that is a seizure that lasts longer than 5 minutes, as well as headache. And we're not just talking about, hey, I've had a long day at work and now my head hurts headache, but a headache that's typically described as the worst headache of my entire life. So these are some things that I was kind of hoping to bring in a guest lecturer on. People with some experience, specifically in stroke, but due to the current state of the world, I'm not really able to do that. So we're going to stick with PowerPoint, and hopefully you get something out of this. Again, remember, Khan Academy is a really excellent source for learning above and beyond what you're able to get here. I just kind of like the way that they draw things out, and that's just above the technology level that we possess here at New Holland Ambulance. So, a brief introduction. Stroke is the 5th leading cause of death and the leading cause of adult disability in the United States. And this is very common, especially in geriatric patients. Bear with me here, I'm just adjusting the microphone. I'm sure that sounds terrible. So other contributing factors for stroke include family history as well as race. Treatments are available for stroke. Many hospitals are certified stroke centers, and rapid transport is vital. So around here we have Lancaster General Hospital is our closest comprehensive stroke center. Reading Hospital is a comprehensive stroke center. And Wellspan York Hospital is a comprehensive stroke center, as well as Penn State Milton S. Hershey Medical Center. So all of those hospitals are able to take care of every type of stroke. They're able to do most common stroke surgeries, where they would go in surgically and remove a clot. The smaller hospitals like UPMC, Wellspan Ephrata Hospital, our St. Joe's Hospital in Reading are all certified stroke centers. They can bring in stroke patients. They can do some treatment for strokes, but a lot of patients who require surgical intervention have to get transferred. Seizures and altered mental status may also occur in these stroke patients. Seizures may occur as a result of a recent or prior head injury, a brain tumor, metabolic problems, fever, or genetic disposition. So some possible causes for altered mental status can include intoxication, head injury, hypoxia, stroke, metabolic disturbances. And the treatments for these vary widely. But there is one thing that we as EMTs can do to kind of help guide us in the appropriate direction when we are assessing these patients. And that is, anytime somebody has an altered mental status, we can check their blood sugar with our blood glucose meter. So if you have family members or you yourselves are diabetic, you'd be familiar with that. If not, that's something that we'll get to go over in the classroom when we get back together. So anatomy and physiology. The brain is the body's computer. Right? The brain is controlling our breathing, our speech, and all of our body functions. 3 major parts of the brain include the brainstem, the cerebellum, and the cerebrum. The cerebrum is the largest part. So if we look here on the diagram, we see the cerebrum. That's the big chunk of the brain that we think of when we draw a picture of the brain. And that is encased in our skull. And the brainstem being this part here, I'm not sure if you can see my cursor or not. I'm just going to pretend like you can, but I don't think you can, so I apologize. And the cerebellum is back here, the backside of the brain. And then, of course, that's all connected to the spinal cord. So, the anatomy and physiology. Our brain stem controls the most basic functions. So, breathing, blood pressure, swallowing, pupil constriction or dilation. The cerebellum controls muscle and body coordination, walking, writing, picking up a coin, playing the piano, clicking the next on the PowerPoint here. The cerebrum is divided into right side and left sided hemispheres. So each side controls activities on the opposite side of the body. The front of the cerebrum controls our emotion and thought. The middle part controls our sensation and our movement, and the back controls our sight. So in most people, speech is controlled on the left side of the brain, nearer to the middle of the cerebrum. Messages that are sent to and from the brain travel through our nerves. There are 12 cranial nerves that run directly from the brain to the parts of the head, the eyes, ears, nose, and face. Now you could look those up. We don't need to know them specifically. The rest of the nerves join the spinal cord and they exit the brain through a large opening at the base of the skull called the foramen magnum. At each vertebrae, in the neck and the back, 2 nerves branch out, and those are our spinal nerves. These carry signals to and from the body. So here we see the branches as they branch out from the cerebellum through the brainstem and then down into our spinal cord. This episode is brought to you by Rain, Total Body Fuel. So, pathophysiology. Many different disorders cause brain dysfunction. That's what we're going to be dealing with. We're going to deal with dysfunction of the brain as EMTs. So this is going to affect the patient's level of consciousness, their speech, their voluntary muscle control. Remember when we talked about assessment and we were doing things like fine motor coordination? Those things will be affected with patients who are having a stroke. Brain is very sensitive to changes in oxygen, glucose, and temperature, and that's why we check those things. We can check oxygen saturation with a pulse oximeter on our fingertip. We can check glucose from the fingertip, and we can check the patient's temperature. As a general rule, if a problem is caused primarily by disorders in the heart and lungs, the entire brain is also affected. If primary problem is in the brain, only part of the brain is affected. So, headaches. One of the most common complaints can be a symptom of another condition or a neurologic condition of its own. Only a small percentage of headaches are caused by a serious medical condition. So like I said, we're not talking about, I just have a headache, I've had a rough day, maybe I'm having some sort of a neurological emergency. What we're talking about is I'm having the worst headache of my life, writhing in pain, feels like I just got struck by lightning in the head. Those patients are probably having a pretty severe, maybe hemorrhagic issue and or maybe a blood clot issue, and they need to be seen quickly. Tension headaches, migraines, and sinus headaches are the most common, and those are not life-threatening. So we're not going to really go too deep into it, but tension headaches are caused by muscle spasms in the head, usually from stress. Their pain is dull or an achy pain, right? We have these all the time. Migraine headaches are thought to be caused by changes in blood vessel size in the base of the brain. They're experienced by adults and children. It's usually a strong pain, a pounding, throbbing, or pulsating pain, maybe vomiting, maybe nauseated. They might have some visual disturbances. They can last for days or they can last for hours. Sinus headaches caused by pressure of a result of fluid accumulation in the sinus cavity, so right in here. Patients can also have cold-like symptoms with nasal congestion, cough, or fever. Pre-hospital emergency care are not really required for these. Serious conditions that include headache as a symptom are hemorrhagic stroke, brain tumor, and meningitis. So if a patient complains of a sudden onset of a severe headache, or a sudden headache that has associated symptoms, we should be suspicious. Suspect stroke in patients with a severe headache, seizures, or an altered mental status. Increased intracranial pressure, or ICP, may be caused by a hemorrhagic stroke, tumor, or recent head trauma. So a stroke, let's talk about strokes. Strokes are also known as a cerebrovascular accident, so you'll hear CVA. That's an interruption of blood flow to an area within the brain, and this results in the loss of brain function. Lacking of oxygen, brain cells stop functioning and they begin to die within minutes. So once the brain cells die, it's my wife. Once the brain cells die, not much can be done. Hi. I am recording. And I am 25 slides in. Okay. Text me. Bye. I'm not going to cut that one out because that is raw. I apologize. My wife is working and I am working. So there are two main types of stroke. Ischemic, which is from the lack of blood flow, and hemorrhagic. So I just want to pause real quick. That phone call thing was funny. If you want to take a picture of that, screenshot or whatever you do, and post that up on Instagram to give me a little bit of a laugh, or tag her in it, because that would be even funnier, go ahead and do that. She'll get a kick out of it. Ischemic stroke. So the most common, and this is going to account for 80% of strokes. This results from the thrombus or an embolus. So either a clot or like an air bubble or something, or for an object in the blood vessels that's blocking blood flow to a specific area of the brain. So think about it like a clot in here. We're going to look at it in the next slide. So here we see a clot, and the clot is blocking blood flow to the left side of the brain, or at least it's left on my screen. And this is what it looks like over on a CAT scan, right? So this is a hemorrhagic stroke. 13% of strokes are hemorrhagic, so we have a burst blood vessel inside the brain. Cerebral hemorrhages are oftentimes fatal, right? So they come on quick, sudden headache. They result in this mass of blood inside, increased pressure in the brain, and they cause death, right? So people who are at the highest risk usually have blood pressure issues. So chronic lifelong blood pressure issues, their vessels are weak, there's a weakening in the wall, and it causes a burst vessel. And that looks like here. So here we see hemorrhagic stroke and aneurysm. We see enlargement of the wall of the artery, and this is the result from weakening the wall of the artery. It's under constant pressure from high blood pressure, lifelong blood vessel disorders, and we get a burst, right? So the symptoms of sudden onset of severe headache. Again, when a hemorrhagic stroke occurs in an otherwise healthy young person, it's likely caused by a berry aneurysm. That should say brain aneurysm, I believe. Surgical repair may be possible if care is sought immediately. I worked with a guy who is a paramedic and a nurse, and he had a sudden onset of the worst headache of his life, and he had a hemorrhagic stroke, and he's a few years younger than I am. So it does affect people of all ages, not just elderly, not just people with high blood pressure, but there can be some underlying disease pathways that will cause hemorrhagic stroke. Transient ischemic attack, or a TIA, is when blood flow to the brain is obstructed due to atherosclerosis, or a small blood clot. The patient may exhibit signs of a stroke. When stroke-like symptoms go away on their own in less than 24 hours, the event is called a TIA. No death of tissue occurs with a TIA. So sometimes we'll see TIAs in patients, and their signs and symptoms will go away in our presence. So they'll call us for a stroke, we'll get there, and during transport, for instance, they will resolve and they'll get better. And that would be a sign of a TIA. We may not be able to differentiate between a stroke and a TIA if their symptoms remain persistent for us. But don't be mistaken, this is an emergency. This can be a warning sign that more significant strokes may occur in the future. All patients with a stroke or a TIA should be evaluated by a physician. So what do the signs and symptoms of a stroke look like? So we know facial drooping is a big common one that we talk about. Sudden weakness or numbness in the face, arm, leg, or on one side of the body. Decreased or absent movement and sensation on one side of the body. Lack of muscle coordination, known as ataxia, or loss of balance. Sudden vision loss in one eye, blurred or double vision, difficulty swallowing, decreased level of responsiveness, and speech disorders. So when we're asking questions of these patients, we want to ask them if they have sudden vision loss in one eye or vision loss in one eye. Did it come on suddenly, or do you always have sudden vision, or do you always have vision loss? Blurred or double vision. Most patients have blurry vision to begin with. So ask some qualifying questions. Is it always like that? Is this new? When did it start? Aphasia. So this is the difficulty expressing thoughts or the inability to use the right words. We would call that expressive aphasia. Difficulty understanding spoken words, receptive aphasia. So sometimes they can understand what we're saying, but they can't come up with the right word. And there's nothing wrong with asking them that specifically. And that would look something like, I know you understand what I'm saying. Are you having a hard time formulating your thoughts? And usually they can just nod their head, yes. Sudden and severe headaches, confusion, dizziness, weakness, combativeness, restlessness, tongue deviation, or coma. So a really vast signs and symptoms for stroke patients that we need to be aware of. So in the left hemisphere, stroke in the left cerebral hemisphere can cause aphasia, inability to produce or understand speech. Speech problems can vary widely. Stroke may also cause paralysis of the right side of the body. In the right hemisphere, stroke may cause paralysis on the left side of the body. Usually these patients can understand our language and they are still able to speak, although their words can be slurred. Patients may be oblivious to their problem, so they just don't know that they're having a stroke. Neglect and lack of pain cause many patients to delay seeking help. Bleeding in the brain. Patients may have high blood pressure. This may be the cause of the bleeding. This may be caused by the bleeding as a compensatory response. Increasing blood pressure is an important sign. Significant drops in blood pressure may occur as the patient's condition begins to worsen. Monitor their blood pressure for changes. Conditions that may mimic stroke. Hypoglycemia, so low blood sugar can mimic a stroke, and this is why we check it on all stroke patients. A post-ictal state. This is a following period after a seizure, and it usually lasts between 5 and 30 minutes. It can be longer at times. And this is characterized by labored respiration, some degree of altered mental status. Depending on how strong the patient's seizure is, they can have severe altered mental status, or they can be combative. Subdural or epidural bleeding is blood near the skull that presses on the brain. And we're going to see it right in here. So here in the diagram that should be on your left, the subdural hematoma is pushing in on the brain, and you see this increased space in there where the blood is in red, and that is going to be increasing the pressure on the brain. That's going to cause some stroke-like symptoms. And this is where we're going to pause for the end of part 1 of the video.